name's Dr. Maria Daves and I do the Autism Diagnostic Assessments here at Harley Therapy. When considering an autism diagnostic assessment, there are lots of different factors to consider. So when people come to see me in my clinic, I'm interested in why now? What is it about that's going on in your life that an autistic assessment is warranted? And given that, I want to talk about just some key features of those on the autism spectrum. Those on the autism spectrum tend to have difficulties with social interaction, social communication, and flexibility of thought, as well as difficulties around change and sensory sensitivities. I'm just going to talk a little bit about the social interaction. So those on the autistic spectrum can find it difficult to develop friendships and make friends, manage unstructured social activities, understand the unspoken rules, and find working in groups very tricky. Often they find it hard to initiate social engagements with others because they're not sure what to say, and they can feel an immense amount of anxiety, and this also is an additional compounding factor. Those on the autistic spectrum tend to have difficulties with what we know as social communication. What that means is those on the autistic spectrum find non-verbal expressive communication very difficult to read. So this could be the use of gestures, facial expressions, as well as social uses of language. If we think about social banter, understanding jokes and sarcasm, these can also be incredibly tricky for them. Reciprocal conversations can also be hard because it requires an individual to think and infer what the other person may say. Those on the autistic spectrum find this challenging. Some of the additional difficulties around this is processing and retaining verbal information and then answering somebody back within that spontaneous social engagement. That's not to say as well that people on the autistic spectrum are not funny. They can have a great sense of humour, and some of the clients that I've met over the years have got brilliant sense of humours and able to use it in a variety of settings. But there can be a difficulty in understanding other people's humour and social banter in the moment within that social interaction with their peers. Another aspect that they find difficult is something known as flexible thinking. So changes in their routine can be incredibly hard for them, particularly if they're out of the blue and they don't know that it's coming, and it can cause a tremendous amount of anxiety. So managing unpredictability can be very hard, particularly if it's not on the autistic individual's terms. One of the other challenges that comes in is understanding the thoughts and feelings of others. So to understand people's thoughts and feelings, we need to have kind of a good grip and understanding of non-verbal communication. So if this is a challenge, then understanding the thought and feelings of other people is going to be hard for them. Another factor to consider is sensory sensitivities, or something known as sensory processing, and this can come in lots of different domains. You've got auditory processing, tactile, olfactory, symmetry, and this can be hypo or hyper. For example, if you have an individual that's got hyper-auditory sensitivities, they can be very sensitive to slight noises from lights, for example, noises from the radiator, computer noises. You know, they can almost hear things that others can't, and this can be incredibly hard for them to filter out. In addition to that, if you've got an individual that's also sensitive to movement of others or anxious around busy environments, this can be incredibly overloading for somebody on the autistic spectrum and can cause them and something that we known as an autistic meltdown, where their brain is too overloaded with all the sensory input that nothing can be filtered through. Some of the other difficulties that I've experienced in working with those autistic individuals is that they can have challenges with something we call executive functioning. Now, this is essentially the ability to sort of plan, prioritise, coordinate different tasks, as well as manage their own emotional identification and regulation, and their attentional flexibility, as well as working memory. So if we think about working memory and keeping up with conversations, that might be quite difficult at times. Making decisions, as well as weighing up the pros and cons of choices, and processing information. So some of the work that I do is breaking down the executive function and look at how this may affect somebody. And in an assessment, this is something that I would particularly be looking at. Just to bear in mind with executive functioning, this can also overlap with ADHD, but that's a talk for another time. One of the other aspects that I look at when we're thinking about an autistic individual and they're coming for an assessment is their understanding of, sort of seeing the bigger picture of the situation or the general gist, because those on the autistic spectrum can struggle with this. And again, this relates back to the social communication and flexibility of thinking. And again, I can't go into that in detail at the moment. That is for a separate training session. One of the other things to consider about common features of autism is that autistic people experience elevated anxiety, and this is often due to the core features and symptomatology of the autistic spectrum. So if we think about social imagination around flexible thinking, social interaction, social communication, processing all of those things at one time can be incredibly overloading, and then you've got additional sensory processing things going on, trying to understand the context of the situation. So the anxiety can be very, very high in these individuals, and often modified CBT or having a very person-centred approach to help manage their anxiety can be incredibly useful for them. So just to summarise, if you feel that there are aspects or features that I've mentioned today in this talk about autism and this relates to you, then maybe it's worth getting in touch with Harley Therapy. Now, you don't necessarily have to pursue a full diagnostic assessment of autism, but you could ask for a screening session to come to see me. I can work through with you what the presenting challenges are for you and how they're having an impact on your everyday functioning.